Mayo Clinic Platform Accelerate, an immersive program for health tech startups, launched its initial cohort of participating companies in March. It is a 20-week program that helps those AI companies get market ready.
Mayo Clinic Platform is focused on building partnerships with companies and innovators to solve really challenging problems that are experienced by patients around the world. ABC6 News reporter Mackenzie Davis spoke with Mayo Clinic and one of the startups about how they're helping patients with epilepsy worldwide. Very interesting, Mackenzie.
Yes, James and Laura, Seer Medical is a startup out of Australia and just finished its 20 weeks here with Mayo Clinic. And they tell me that partnering with Mayo Clinic has accelerated their product development by many years. And the company has now established a presence here in the United States. The medical company specializes in helping people with epilepsy with the goal of shortening the path to care. Seer Medical has been operating for about 5 years, and over those years they have grown really quickly in Australia, and now they hope to replicate the success from the land down under here in the United States.
The idea here is that we want to make sure that the impact that these companies are making is not just limited to the US, but to the global market.
The current status quo in epilepsy is it takes over 5 years to reach control. We want to shorten that path down to just a couple of weeks.
And with the help of artificial intelligence, Seer has developed 3 revolutionary products. The first is a digital neurologist, which helps people triage through the healthcare system so they can get the right tests and see the right specialists. The second product is Seer Home, taking hospital tests into the comfort of the patient's home.
So this device is something that would take what would normally be very complex equipment that could only be used in a hospital and reduce it down to something that can be worn on the patient.
Seer captures a lot of data, but with the help of AI methods to read that data, AI is helping reduce the time a scientist would have to go through all of that data to find events like seizures.
This is only about 2 seconds of data, but this is 2 seconds within a week of recording. It's like a needle in a haystack, and that's why we need the AI systems to be able to read the data.
One patient was diagnosed with epilepsy, but they actually ended up having a cardiac problem. But they never would have discovered this without this type of at-home test and artificial intelligence.
That's one of the great promises of AI and machine learning, that we can develop algorithms to go through the data and pull out useful information.
The third is Seer Health. The main feature is a seizure risk forecast, which is like a weather forecast for their epilepsy. It's as simple as an app on your phone and a Fitbit watch.
And what we see here on the screen is a calendar view of someone's risk of having a seizure over the time course of a month. So what this means for the person is they can look ahead in time and plan their day-to-day activities so they can live their life with greater confidence and less anxiety.
Just launched in June, there are already thousands of people using this app to guide their daily activities. Dr. Freestone and Dr. Brinkman hope that these products with Seer result in better care for people with epilepsy in general, and that they will be able to provide care to more patients and extend care to other places in the world where they don't have the resources that we have here at Mayo Clinic. They're also very optimistic about these products. James and Laura.